I am Sam Makhoul, the medical director of the clinical research department at CARTI. The incidence of colorectal cancer is coming down in general. When we look at the population older than 50 years old, the incidence is dropping significantly, 1% a year. But when we look at the population younger than 50 years old, the incidence is rising. However, you have to realize that only 10% of our population with colon cancer are younger than 50. So the rise in that population is significant, but it doesn't affect the global incidence of colorectal cancer. Older people are getting screened, and we are detecting the cancer early, therefore it's curable and doesn't lead to death. And on the other hand, we remove the premalignant lesions, the polyps. And as a result of that, the seed of cancer doesn't move all the way to become a tree of cancer. The incidence of colorectal cancer in Arkansas is not significantly higher than the rest of the population in the United States. However, we are detecting these cancers very late. The incidence of screening for colorectal cancer in Arkansas is not as good as the rest of the nation. And that's why when the cancer becomes symptomatic, meaning you have some symptoms from this cancer, it's already too late. 90 to 95% of colorectal cancers occur in a way that without having any family history or genetic mutation, known genetic mutation to you or to your family. So we call it sporadic colorectal cancers. The risks for colorectal cancer has increased in the population. Some of those are overweight and obesity, for example. This is not specific to older folks. Diabetes. Bad diet is one of the other risk factors. And we see now increase or rise in the incidence of obesity and diabetes in younger folks. And as a result of that, we see more colorectal cancer in this younger population. So it's not only a disease of the elderly. Those who are exhibiting symptoms, they need definite colonoscopy, not screening anymore, because they have the disease and we need to know the extent of the disease. Therefore, we do colonoscopies, we do scans, and so on. In reality, screening is best suited for those patients who have not had any symptoms. So there are no warning signs, really, so to speak, for colorectal cancer. Anybody who is 45 years old or older is eligible for screening for colorectal cancer, knowing that 90 to 95% of colorectal cancers happen haphazardly because of bad luck, not bad genes. If I have a family history of colorectal cancer without any genetic mutation, when should I start screening? I tell my patients, you start 10 years earlier than the youngest person who had colorectal cancer in your family. Somebody who had colorectal cancer at age 45, you start at 35, and so on and so forth. Symptoms of colorectal cancer can be diverse and sometimes might appear benign. However, anybody who has blood in their stools, they have difficulty moving their bowels, or alternating constipation and diarrhea, or decrease of the diameter of their stools, they become pencil-like, and pain in the pelvis when they move their bowels, they should seek medical attention. Sometimes the symptoms are a little bit indirect because of the cancer that starts in the right side of the colon, can get to a large size and start the bleeding, small drip, small amount of blood, and the patients become anemic. They have iron deficiency anemia. If you are of certain age or postmenopausal woman who is not having any periods anymore, therefore not losing blood in her periods, if you have iron deficiency anemia, you should be considered for possible colorectal cancer. The most important thing is to make sure that you have maintained a healthy weight, you are exercising well. Diabetes is one of the risk factors, so is alcohol use, actually. And part of the lifestyle that we have can contribute to the risk of colorectal cancer. Some of that is consuming a lot of red meat, and red meat can be beef, can be pork, can be liver. Processed meats in general are not good for our health when we consume them in excess. On the other hand, the way that you prepare the meat is important. Anything that would lead to high temperature preparation, for example, broiling, grilling, and frying, might result in the formation of some compounds that are carcinogenic. And the studies that led to this conclusion were conducted in Arkansas in reality, that showed that the use of red meat and the preparation of red meat, the type of preparation, impacts significantly the incidence of colorectal cancer. Vitamin D deficiency is a risk factor as well. We don't go in the sun enough on a daily basis to get the vitamin D needed for our body. The best way to do it, you take supplement. You can see your doctor, check the level of vitamin D in your blood to adjust the amount that you need to take, and that would take care of it. So there are many things that we can do that would decrease the risk of colorectal cancer, and that depends on us, and we can do it.